Hi, I'm Dr. Andrew Sylvester, and I'm here to switch gears a little bit today and give you some pointers that, in my years of experience, will help you in your work in the future in dealing specifically with psychiatrists and physicians. So, I boiled it down to 5 key things that I think is really helpful for all social workers to know. The first of those is to know your role. Every one of us on a treatment team has a specific role, and they're all important. One should never feel that their role is any lesser than anyone else's. At the same time, it's really important to make sure you're not overstepping your bounds in your role, because that sets off a lot of political fighting and defensiveness that's not helpful for patients in the end. Your role when working with physicians and psychiatrists are primarily to educate, advocate, ask questions, and provide details around specific concerns or symptoms that you're seeing in the clients you work with. It's important to remember that you should never tell a patient to stop, start, or adjust the dose of a medication without a direct order or contact from their prescriber or whatever prescriber may be covering for them in their absence. Otherwise, you're practicing medicine without a license, which carries grave consequences and could lead to the loss of your own license. Instead, it's important to educate patients on their medications, potential side effects, the duration of expected effect before it starts working, and to communicate with them to the extent that your training and experience provides. It's your job to help advocate for clients with the physicians that you do work with. When you're seeing side effects or concerns about emerging symptoms, we need to know that. It's very helpful for us to have social workers who have eyes in the field be able to give us direct, objective reports about what a patient is experiencing. When you find a patient having problems with a particular area, it's really important to bring that as a concern and ask for help instead of directing us what to do. I can't tell you the number of times I've had somebody tell me, oh, they need a sleeper. There are many reasons for insomnia. Some of them may require sleeping medication, but some of them may require further workup or other interventions. And it's important for us to really know the specifics of what's going on with their symptoms to make the best choice possible. Ask for help when working with a psychiatrist instead of demanding or pushing for a particular agenda. If you are getting pushback from a physician that you're working with, it's always best to resort to a position that what you're doing is really because of your concern about a client's well-being and function. It's an unassailable position to move from.